psychologist is primarily a profession that is focused on helping people to recover from emotional and psychological distress. It requires a lot of training and, I would say, a certain temperament or personality. You have to really like working with people. Yes, it is. I can honestly say it's been a great profession. I've really enjoyed it. And as I was saying earlier, one of the biggest challenges for people often is that they're daunted by the amount of training in graduate school it requires. But graduate school is really fun. So graduate school didn't feel like a big chore. So all in all, both graduate school and the profession have been a really great choice. I like the challenge of trying to help to sort out the causes of people's emotional and psychological distress, and then finding ways of treating that or helping them find solutions. Well, when I was in private practice, my day involved more of the business end of a practice in addition to the clinical work. Right now, I'm working for a company that provides mental health in nursing homes, and the company handles all the business end for me, which is very helpful to me. So now I go to work, I review medical charts, I talk to medical staff and nurses, see my patients, I do some testing, record keeping, but the majority of my time is spent with my patients. Well, I would say in some ways, yes. It's a lot of responsibility to be a psychologist because the people that you're working with have to trust you in order for the work to be effective. So you kind of have to hold yourself to a higher standard. Well, I've had clients who have told me that that's the case. I'd like to think that I have. You know, that's what we strive for. Well, I don't actually make the amount of money that I used to make. Reimbursement rates through health insurance have gone down fairly steadily over the past 10 years. So it could be better, but at the same time, it's not too bad. The word therapist refers to any kind of mental health professional who's had some training, and they may be licensed or not licensed. So a therapist might be a social worker, a master's level psychology major, and a psychologist, on the other hand, has a very specific and defined kind of training. You have a lot of rules that you have to abide by, professional and ethical rules, and also you have to be licensed and registered with the state in which you're providing services. So it's a fairly regimented profession. There's a lot of accountability involved in being a psychologist. And you have a PhD from a psychology graduate training program. It requires, after college, it requires a graduate program that results in a doctorate, a PhD type program. But graduate school takes about 8 years, and then you have a year of internship, and then about a year of supervised clinical experience. And after you've done all that, you can sit for the licensing exam in the state where you plan on seeing patients. That's kind of uncommon. I think the important thing is to really develop your interests while you're in graduate school, so that by the time you graduate, you already sort of have a resume started.
Thank you so much, Dr. McElroy.
Thank you. I enjoyed that.
Me not working hard. Yeah, right. Picture that with a Kodak. Or better yet, go to Times Square, take a
after.
Oh, God.
I said take her.
You can cut that out.
Hannah.